All right, today we are jumping headfirst into a true medical detective story. We're talking about what happens when the spine, your body's command center, suddenly sends out a massive SOS. But there's no accident, no injury, no obvious cause at all. These are the spine's silent emergencies.
I mean, just imagine it for a second. One moment, everything is totally normal. The next, you're dealing with sudden weakness, maybe numbness. You're losing control. Your body's central wiring is in crisis mode, and believe me, the clock is ticking.
So this is the heart of our mystery today. These are called atraumatic spinal emergencies. And that just means the patient didn't get in a car wreck, they didn't fall down the stairs, the symptoms just appear, out of the blue. This forces doctors in the ER to become detectives, and their number one tool is advanced imaging.
So our investigation begins. We've got a patient in distress, the symptoms are, frankly, baffling, and the big question for doctors is, where do we even start looking for clues?
Well, it turns out the entire investigation, the whole thing, really hinges on one single, crucial question. And the answer sends doctors down one of two completely different paths.
And here it is something physically squeezing the spinal cord from the outside. We call that a compressive issue. Or is the spinal cord itself the problem? Is it sick? Is it damaged from within? That's a non-compressive issue. Getting this right is everything because it determines the treatment. Are we rushing to surgery or are we using medication?
Okay, so to really get these two paths, we need a map of the territory. Think of this as our crime scene, a cross-section of the spinal cord. It's the information superhighway for your entire body, and it's wrapped up in a few protective layers.
So the first place a problem can pop up is here, in the epidural space. This is the area outside that tough outer layer called the dura. You see that red mass in the diagram? That's a great example of how a tumor or maybe an infection can grow there and start putting a dangerous amount of pressure on the cord.
But a problem can also show up inside that protective layer, in what's called the subarachnoid space. This spot is filled with fluid, and it's where the spinal cord actually lives. So as you can imagine, if a mass grows in here, it gets dangerously close and directly squeezes those vital nerves.
Okay, so let's follow that first trail of clues. We're going down the compressive path, hunting for the culprits that are putting the squeeze on the spinal cord.
Our first suspect is something called multiple myeloma. This is a cancer that makes tumors inside the bone, and when those tumors decide to grow in the vertebrae, the bones of the spine, they can push right into that epidural space and cause some really severe spinal cord compression.
And this is just a fantastic example of how radiologists piece together the evidence. On the left, you've got a CT scan. It's amazing for looking at bone. But check out the MRI on the right. That gives us the real smoking gun. It shows the soft tissue tumor itself, that gray blob, pushing right into the spinal canal and squishing the cord. You need both tools to get the full story.
You know, the best detectives are always looking for patterns, for a signature. And in radiology, it's exactly the same. Sometimes a medical condition leaves behind a visual calling card.
You have got to see this. On the left, that's an MRI from a patient with bleeding inside the dura. Well, some very sharp radiologists noticed its unique shape looks a whole lot like an upside-down Mercedes-Benz logo. So now this inverted Mercedes-Benz sign is a famous, almost instant clue that screams a specific diagnosis. It's a clever trick that helps doctors act fast.
All right, time for a pivot. What if the scans come back and there's nothing? No pressure, no tumor, no bleed on the outside. What happens when the problem is an inside job? This takes us down our second path, the non-compressive emergencies.
Our first non-compressive case is transverse myelitis. So for this one, don't think about pressure. Think about an internal fire. The spinal cord itself gets inflamed, and a lot of the time it's because the body's own immune system just goes haywire, maybe after an infection.
And this MRI shows you exactly what that inflammation looks like. See that long, super bright white signal running right down the middle of the cord? That's not pressure. That's the cord itself basically screaming for help. It is swollen and inflamed from the inside out.
But an overactive immune system isn't the only internal bad guy. Just like every other part of your body, the spinal cord needs a good, steady supply of blood. And if that gets cut off, you've got a huge emergency on your hands.
This is called a spinal cord infarct. And honestly, the easiest way to think about it is as a stroke. You know, just like a stroke in the brain, but this time it's happening in the spinal cord. An artery gets blocked, a part of the cord is starved of oxygen, and the nerve cells start to die. Now check out the cool tech they used to find this. This is not your standard MRI. It's a special kind called diffusion-weighted imaging,
and it is incredibly good at seeing the kind of cell damage a stroke causes. That bright white spot right there, that's the money shot. It tells doctors exactly where the blood supply was cut off.
So, we've gone down both paths, we've looked at the clues. Let's zoom out. How does all this fit together in a real emergency to actually help doctors save patients? Well, it all follows a very clear, very logical roadmap.
This is pretty much the whole detective process in 5 simple steps. It kicks off with the patient's symptoms. Then comes that all-important fork in the road, compressive or non-compressive. From there, imaging gives us the key clues, where the problem is and what it is. Radiologists hunt for those telltale patterns to lock in the diagnosis, and that diagnosis points the whole medical team to the right treatment. It separates the cases that need a surgeon from the ones that need medication. And this is exactly why this all matters so much. This framework is literally a lifeline. Getting that first call right, compressive versus non-compressive, is the most critical step of all. It's the difference between rushing a patient into surgery to relieve that pressure or starting them on powerful drugs. It has a direct, massive impact on their chance of walking out of the hospital.
And hey, you don't have to take my word for it. The experts who literally wrote the book on this stuff put it perfectly. They say that figuring out where the problem started, inside or outside the cord's protective layers, is the single most important first step. It is the key that unlocks the entire puzzle.
So it turns out a medical scan is so much more than just a black and white picture, isn't it? It's a story. It's a mystery novel, just packed with clues and patterns and hidden signatures, all waiting for a good detective to piece it all together. Which kind of leaves us with one last thought. The next time you happen to see one, what hidden clues are you going to look for?